Hey y'all. What? Wait. This ain't gonna work.
Not at all.
Let me fix that. It worked. That's great.
We had a viewer ask us if we ever changed sides or changed the chair that we sit in. No, we don't. And the reason why we don't is because that's like changing what side of the bed you sleep on. Who does that?
Not me.
Not me
I
either.
like my side.
So, no, we're going to sit like this if that's okay with you. Today's video is packed with everything you need to know about the French healthcare system, especially if you are planning to retire in France in 2025. It's in depth, it's practical, and we're going to break it all down step by step.
Step by step. Healthcare can actually be one of the biggest concerns when moving abroad. And trust us, France has one of the best systems in the world. So let's dive in.
Now, France has a universal healthcare system that is consistently ranked one of the best globally. It's called the Assurance Maladie, and it covers about 70% of your medical costs, sometimes more if you have a serious or chronic illness.
Now, most people, they top up their coverage with a private plan called the Mutuelle, which fills in the rest. We will get into that in just a little bit.
Right. Healthcare in France is publicly funded through payroll taxes and government contributions. But here's the great thing for expats. As long as you have been living in France legally for 3 months, you can apply for coverage.
So, what is step one? You'll need to register with your local CPAM office. That will be the health insurance office that is handled in your region. The easiest way is to apply online through the ameli.fr, which is the official site, and we will post that down below.
So here is a list of items that you will need to register. Your residency permit or long stay visa, your passport, proof of address, as in a utility bill, a birth certificate, often with a certified translation, an RIB, which is your French bank details, and proof of income or employment if applicable.
I can't say that other word though.
What?
Social.
Where?
What? Social.
Social security number. You. I cannot believe I fell for that.
You're like, what word? I don't see any other bad words. Hard words. Now, once approved, you'll get your social security number, and then you will get your Carte Vitale, which is your health card. You use it every time you go to the doctor, the pharmacy, or the hospital. It will track your care and automatically sends reimbursements to your bank.
And as of 2025, there's also a digital Carte Vitale that you can download to your smartphone, but only what?
What if I don't have a smartphone?
You got a flip phone?
No, I've got a dumb phone.
The new digital Carte Vitale is only available if you have the newer biometric French ID. And even though France covers a big portion of your costs, most residents still have a Mutuelle, which is a private supplementary insurance.
It helps pay for the copays and the extras that the public insurance does not cover, like dental, optical, and private hospital rooms.
Now, some employers provide Mutuelle coverage, but if you're self-employed or on a visitor visa, you'll need to find one yourself. There are companies like April or AXA and Mondesor that offer these, and have English speaking support. Now, please know we are not recommending these companies. We are not endorsing these companies. We're just letting you know they exist.
And if you're not eligible for public insurance yet, like in your first 3 months, you'll need international expat insurance to cover you during that gap.
If you are moving to France from another EU country, you might be able to use the S1 form from your home country, especially if you are a pensioner.
Now that lets you access French healthcare without paying into the French system, but you'll still have to register with the CPAM and get your Carte Vitale.
If you're only visiting for the short term, the EHIC or the European Health Insurance Card can cover you temporarily. But for long stays, most people will enter the system through PUMA, and that is France's universal healthcare coverage based on residency.
Here's how actual care works. You're free to choose any doctor you want, but it's a good idea to declare médecin traitant, which is your primary doctor.
And why is that?
Because I said.
Because he said so. And because if you don't, your reimbursements are lower. Your médecin traitant coordinates your care and also gives you referrals to specialists.
Appointments are usually quick and affordable. A general practitioner visit costs probably right around 26 euros, and you get 70% of that reimbursed automatically. And if you have a mutuelle, they'll usually cover the rest.
For booking appointments, most people use an app or website called Doctolib. It's easy, and a lot of doctors even offer video consultations. What do we ever do without video consultations?
I've only done one in my whole life, and that was during the COVID, whenever I had to talk to the doctor.
Yeah.
Other than that, I'd rather see him in person.
France also offers healthcare options for low-income residents or undocumented people. There's a system called AME, which is the Aide Médicale de l'État, that gives access to care after 3 months of residence, regardless of status. Do you want to talk about healthcare too, George?
About your hacking?
Yeah, you need to talk about your medical care.
You need medical care.
I wonder if there's a cure for crotchetiness. Doubt it.
There's also the CMUC, which is a free mutuelle for low-income residents and subsidies for the middle-income earners.
Now, one challenge is that rural areas can have doctor shortages. It's smart to research access to general practitioners, dentists, and hospitals before choosing where to live, and that's exactly what we will be doing. So let's go over some bonus tips and details that we think that every expat should know.
First of all, the timelines. Registering with CPAM can take about 2 to 6 months, and you might only get a temporary number at first. The Carte Vitale can take even longer to arrive.
And not everything is covered. Alternative medicines like acupuncture or even some dental and optical procedures may only be partially reimbursed.
Acupuncture?
Yeah,
I don't think so.
that's what I mean. Oh, you couldn't do it?
No, I could not do it.
He's scared of needles. You could not do it.
Nope. They'd come at me and say, "We're going to make you better." And I'm going to say, "No, you're not."
Cold day.
Now, hospitals come in 3 types. You have the public, you have the nonprofit private, and for-profit private. Some charge extra fees called dépassement d'honoraires, and mutuelles, they can vary in how much of that will be covered.
If you are a family with kids, know
Not
that
here.
absolutely not here. Know that children are covered under your account, and school-age children often get dental screenings.
One thing you will definitely need, it's going to be a French phrase cheat sheet.
What a coinky dink. We have one of those on our Patreon page.
Yes, we do. Not all doctors speak English, and you may have to bring a translator for complex appointments.
Google Translate to the rescue. At the pharmacy, your prescriptions are digitally tracked through your Carte Vitale. But just remember, things like antibiotics are prescription only and reimbursement varies by drug type.
For emergencies, you'll have to dial 112 or 15 for medical help. You can also go to the ER, but expect those long waits for the non-life-threatening issues.
Just like here. Gone to the ER lately?
Oh, yeah.
Golly. Last time Maddie went, we left after we just sat there and waited for what? A couple hours without even getting to the back. We just gave up.
Yeah, I went to bed.
Ugh. Having adequate insurance is required for residency renewals. Keep your Carte Vitale, your mutual contracts, and your receipts organized. So let's recap, because that was a lot of information thrown at you very quickly. You can join the French healthcare system after 3 months of legal residence.
You can register through CPAM and get your Carte Vitale, but expect delays.
Always declare a médecin traitant.
And get a mutuelle to cover what public insurance does not.
Bring private insurance for your first 3 months.
Use Doctolib for appointments and to check your area for healthcare access.
Know your emergency numbers.
And keep all your healthcare documents organized, especially for your visa renewals. Now, it does take a little bit of paperwork and time, but once you're in, you're in.
You're in.
France truly does offer world-class care.
If you found this helpful, please give it a thumbs up and subscribe to follow our journey to retirement in France. Also, let us know in the comments if you have had experience with the French healthcare system or if you have questions that we didn't cover. Don't forget to hit that notification bell so that you can be notified of when our next video will be out, which will be next Saturday at 10 a.m. Central. Please also remember that you can support us over on our Patreon page or Buy Me a Coffee page, or if you want to become a member of this channel, you can just click the join link down below. We also have merch if you want to get some of that as well. So you guys have a great week, and we will see y'all next Saturday morning.
À bientôt.